You're setting records both for the number of people hospitalized with COVID-19 and the number of people in the intensive care units.
According to a report from Duke and UNC researchers, if numbers continue rising at this rate, Triangle hospitals have about 6 weeks until available hospital beds run out.
Currently 415 ICU beds available. That's the lowest on record during the COVID crisis, with 3,631 beds overall. But Dr. Dennis Taylor, who represents the state's 160,000 nurses, says some RNs don't feel they have adequate PPE, and they're encouraging everyone to keep up with safety precautions.
We are really playing with fire as we begin to loosen some of these regulations.
We will need more than 160 million N95 masks in July alone. But the imports and domestic production together will only supply about 130 million masks. That leaves a projected shortfall of about 30 million masks. However, how is it possible? More than 5 months into this crisis, our country is still facing a possible shortage of 30 million N95 masks this month.
The COVID-19 pandemic is an incident that has not only rocked the country, but the entire world. Countless lives have been lost, many of those being the lives of doctors, nurses, caretakers, and other healthcare professionals. A large reason for this is due to the lack of PPE, or personal protective equipment, which includes medical gloves, gowns, and masks.
And then coming here, we were only given one N95 to use for 5 days. Usually that was something you would use when you're exposed to someone, so once you used it, you would dispose of it. So we had to keep ours for 5 days unless it became soiled or, unable to be used.
The shortage of PPE in this country is so great that healthcare workers have resorted to taking to the streets and protesting to get the equipment they need to be safe and do their job. So, how did it get this far? A big reason for this PPE shortage is the supply chain. Rather than making these masks, gowns, and gloves domestically, the US has instead been relying on importing these items from other countries. This issue was exacerbated by the pandemic. China manufactures around 50% of masks and respirators around the world. But when the COVID-19 outbreak occurred in Wuhan, the country focused its efforts on producing masks at home first. Alongside this, many of the people who worked at PPE factories in China couldn't make it to their jobs due to the outbreak. So the virus continued to spread, the demand for PPE continued to rise, and China was exporting and making fewer masks, which only increased the shortage. The stress of the pandemic, which caused an influx of patients as well as shortages of PPE and staff, has negatively affected many healthcare workers, causing extreme stress and burnout.
And when it comes to staff, we definitely have some instances where, things pop up, there's not enough staff, and you have to triple, sometimes quadruple the amount of patients we each have just to meet the needs of the patients during this time. So.
The job of these caretakers already involves a lot of physical and mental labor, and the conditions created by the COVID pandemic has only increased this.
So it's definitely a lot of lifting the patients up, moving them, to change them. We have machines where they're called a Hoyer lift or a sit-stand, depending on the patient's abilities physically. You lift them out of the bed, and then you put them in their wheelchair, or then put them on the shower bed, and you wheel them into the shower room to give them a shower. So it is a lot of physical labor.
This added physical and mental stress has caused many healthcare workers to quit their jobs, and some to leave their field entirely.
A Penn LDI study that looked at hospital understaffing in New York and Illinois
6 in 10 healthcare workers, understandably, say they're burned out. In the same Washington Post Kaiser family poll, 3 in 10 say they considered leaving the job entirely. Many say this last year was their breaking point.
Along with the burnout and the lack of PPE, many healthcare workers had fears about how this pandemic could affect their health and the health of their loved ones.
There have been days initially, because that as long as I wore a mask, I never drank water because I was worried to take out the mask. I don't think any of us expected, because even though we all put ourselves in front, yes, it was we took risk. Then after the work, when we came home, there was again another risk of infecting our family members. That was stressful. I just to talk about myself, initially, even now we follow the same, but whenever I have to take care of COVID patients, I was actually isolating myself because I don't want to be involved or spreading to my family. So that fear was there because we didn't know much about the disease initially. Even though just wearing a mask alone, will that be helpful?
When I first started my job here, I was concerned because, we were learning on how this was transmitted. So I would come in through the garage and remove my clothing and put it in a separate container so as not to expose my family, and shower right away and try to keep my distance because, in the front of my head, I was always concerned, could I bring this home and affect my family?
Despite all the challenges and negative emotions these healthcare workers were facing, they still found a way to fight back and improve this situation for themselves, the patients, and their families. One such way they did this was through the use of telemedicine. By using technology, healthcare workers were more easily able to contact patients and allow them to interact with their loved ones.
So during the pandemic, we had the ability to use the iPhone to conduct patient visits, and then that was when I was in New Jersey, and then when I started working in North Carolina, it was already set up within the app of our program, and we can conduct video visits with the patients and also telephone visits with the patients.
The technology was very useful, so we had plenty of iPads in those COVID units, so we were able to use iPad like a video chat when we round on the patient. Of course, the patients didn't know, they were not able to see our faces with all those, protective ways. They were only able to identify with the 2 eyes and the voices. They can hear the same. But the family members were once we go into the room, we use the iPad to have a video call, connect the family member, and that way it was satisfying for the patient also to see their own family member on the video. At the same time, as a provider, so we could have a family conference and talk.
They have been utilizing other methods as well, such as a more strict screening process to ensure safety.
So we are required to wear masks at all points. We have those hand sanitizer pumps all along the hallway. Some hallways have 20. We are We are supposed to fill out a sheet every morning where you write down your temperature, you write down have you worn your mask upon entering the building. In other words, when you walk into the building, if our masks are hanging on our ear, that's not allowed. You have to have your mask on, and you have to have your hands sanitized before entering the building. So we are definitely encouraged to do so when it comes to that.
So our office started screening processes. So we would screen patients the day before their visit, so to check for any exposures to COVID so that they wouldn't be coming into the office, possibly exposing the staff. And then the day of their visit, we would screen as well again. And then we conduct pulmonary function tests or breathing tests, so patients would have to be screened for COVID, actually get a COVID test before they could come into the office to do that test. So those things were set into place to keep everybody safe.
Also, healthcare workers made sure to check in on their colleagues and see that they were not feeling too tired or drained and that they were taking proper breaks and being hydrated.
Just maintaining enough water. I walked around
would say at least the resources to relieve the stress. For example, like, giving them a day off in between, or taking care of yourself. Like initially for us, like, you had like an extra day off, and make sure you're, I think that's how we took care of each other. And like, taking in between a break and making sure that they have something to eat or drink. I think everybody was watching over others, and it was helpful. It was a great team to work. The teamwork was very helpful to overcome that burnout situation.
While these healthcare workers have been lifting each other up, we as citizens of this community should also work hard to uplift these individuals because they have put so much of their time into doing service for our community. Here are some resources that you can use to help out the healthcare workers in our community.